another episode of Beauty Talk Podcast, where beauty meets wellness. Proudly sponsored by G Skin and Beauty Institute in partnership with estheticians.com. I am Veronica, your host, and today we're diving deep into a topic that affects everyone, chiropractic care. Whether you are in the beauty industry, standing all day, a wellness enthusiast looking for new ways to feel great, or just someone who's curious about cracking your knuckles and why it makes that sound, this episode is for you. We are joined by Dr. Frazer, a chiropractor who brings over 2 decades of experience and a passion for holistic health. Dr. Frazer graduated from the National College of Chiropractic in 1998 and began practicing in Naperville in 1999, and has been serving the Oswego community since he relocated his practice since 2001. In his early 20s, Dr. Frazer managed a nursing home and witnessed firsthand the overuse of medication and the impact of aging and its effects on the body. That experience inspired him to seek a career in holistic health and ultimately led him into the chiropractic care as a way to helping individuals heal and thrive naturally without relying on medications. Today, Dr. Frazer is here to educate us, bust some myths, and help us understand how chiropractic care goes beyond back pain and impacts our posture, our confidence, our mood, and our overall health. Dr. Frazer, thank you so much for being here today. We are so excited. I know I am super excited to interview today. And so thank you so much. And could you just tell us what kind of got you into chiropractic care, a little bit deeper into what I just kind of went over, and what's really pushed your passion?
Thanks for having me, Veronica. I appreciate this is actually my first podcast, so
Hey.
a little nervous, a little change, but man, you really aged me when you said the 2 decades thing. I was like, wow, I've been practicing that long. But
It's been a long time.
Yeah, so I started out trying to go into nursing home administrator, or I was a nursing home administrator, hospital administration, but I was running nursing homes when I was in my early 20s, and really did get to see a firsthand on the medical side of healthcare in terms of over-medication, really what the body does as we age, those type of things. And I was waking up, Monday mornings hating life. I'm like, here I am, 24, 25 years old, and I'm like, I'm going to work and really didn't like it. There's got to be something better. So I started doing some research. I ran into an actual old college roommate of mine that was going to chiropractic school. So I started doing a little bit dive into that. And wham bam, got into chiropractic. And here I am, as you said, 2 decades later, just a few years past my 20s.
Okay.
And doing it ever since and loving every bit of it. So
Yeah, I love that. I mean, I think that we should all strive to doing things that we're passionate about,
Right.
because we spend most of our time in our jobs anyway, right? So
Right.
you might as well love what you do.
Yeah, exactly.
So in the beauty industry, we're always, catering to people. Right. So whether you're a hairstylist, a barber, if we're moving, a hairstylist is blow drying hair up here, a barber is always like this, an esthetician, a permanent makeup artist, we're always hunched over. So what are the benefits of really addressing your posture issues when it comes to our everyday lives?
So I spend a lot of time not only just treating the patients, but also educating the patients as well. And the educational component of that really has to do with a lot on posture. And posture is something that we go over almost with every single patient that comes into our office. And most of the time, due to time restrictions, we talk and start initially with the head. The head weighs anywhere between 5 and 10 pounds. All right, so think of it as like a bowling ball. Right, it's somewhat of that nature. For every 1 degree that we start to go forward, we're putting 10 additional pounds of pressure onto that neck. So as we start to slowly go forward, as you can tell, you're going to put more and more. So all those things that you just mentioned in terms of beauticians, estheticians, barbers, all those things, they all have to go forward, right? Their shoulders are forward, their head are forward, everything is lurched forward. So how do we correct that? Obviously, as an esthetician, you're not going to be doing your work back here. So it's hazards of the job, right? That you're going to do that. But posture is a learned response. Learned response meaning that we learned to tie our shoes when we were very little. We practiced and practiced and practiced until we can do it with our eyes closed and we're not even looking. Posture can be trained even at my age, even at your age.
Oh, goodness.
So what we talk about is how do we do that, and what kind of training of the muscles do we want to work on, and bringing those shoulders back and bringing the head back in there, and we can demonstrate that at some point during this conversation. So, so that's really kind of where we start our focus at in my office.
And so the benefits of posture are eliminating a little bit of that weight from your spinal cord and kind of making everything else relax, is what you're saying, really.
Correct. I mean, so having forward head posture, having your shoulders forward, you're going to shorten basically the muscles in your neck. So that can cause, shortening of the muscles or tightening of the muscles in the back of the neck, which can cause headaches. It can cause you to have shortness of breath because you're decreasing the pectoral muscles in this area. So by having that hunched forward and having shoulders rolled forward, you may not be getting as deep a breath, which means that, your sleep patterns and things that you're doing there can also be affected as well. So,
So I do see, and I notice it in myself, when I've been working really hard on a client, I do have, a saddle chair that kind of forces me to stand or sit up straight. But I notice that I'm always like bringing my shoulders back to kind of stretch those muscles out. But then, and also like a lot of our practices make us get nervous, right? When you're doing a corrective color, when you, doing a fade for somebody who's going to get married the next day, there has to be another level of stress, right? But you're also saying if we have better posture, then we can really take advantage of those deep breaths, the meditation things and techniques that we try to use, and if we are hunchback, we're not getting that full effect.
Right. Correct. Right? And just like you said, you're very focused on what you're doing. Most of the beauty industry is very focused because you're detail, right? You're very detail oriented in terms of what you're working on with your clients. So having that shortness of the muscle and having that intense moment for hour, 2 hours, sometimes 3 hours in the chair and having to be focused so much on that client over them is going to tighten everything up. So what we're saying is work on that posture afterwards. You can't really do that. In the best scenario, during little breaks that you get, you want to bring that back and change the focus of where your shoulders and your head's at. But in terms of having that focused, there's not much you can do. So you want to work on it afterwards. You want to train it so that it almost comes natural. You're not thinking about it. Again, learned responses.
So you're like practicing.
Naturally. Right.
Yeah. Right. So, and earlier we were kind of chatting and you gave us like a little hack and also a different way that we can now say that we are exercising while we drive. Right. What is something that you can recommend to us to maybe do before we get into work and then after we get out of work?
Right. So a lot of times patients will come in and part of, again, besides posture, we talk about exercises. What kind of activities are you doing? Things like that. Most of the time people are coming in to see me might have physical therapy or have had, exercises given to them, or they're even in the gym working out on their own. So they're already kind of doing that. So a lot of times you're like, oh, you're going to actually give me more things to do. This is simple. And all I want my patients to do is work on isometrics when they're in the car driving home or driving to work or driving to wherever they're at. They can even do it at home. But what we want to focus on is sitting neutral in the car. All right. So you're at a stoplight and we want you to come up to that stoplight and we want you to push your head back into that headrest as hard as you can. Focusing on that while it's red. As soon as it turns green, you relax. Go back to your normal driving position, right? So what we're doing is focusing and bringing that head back because all day long we're going forward. Our shoulders are going forward. Our head is going forward. So we want to focus. Isometric, simple. Push your head back in a neutral position, not up here, not down here. We want to come back and we want to hold that position as long as that turns from a red light to a green light.
To
Once
a
it's
green
green,
light.
boom.
And today we are fortunate enough to have a model to give us, like visual learners, a little bit of, an example of what we should actually be doing while we are in our car. So Karen, go ahead and step on in. Show us what we should be doing while we are in the car at that red light. So if you can give us a side profile, and then Doc, if you can guide her,
Sure.
And show us like an example of what our backs are doing when we're not realizing that our posture is bad. What are the activities? Are we on our
So
phone?
this
or
is a
what's
good
going on?
example. Karen sits at her desk all day for the most part, working on the computer. So her shoulders would be forward, her front, exactly, typing.
Okay.
So as you can see, her shoulders are rolled forward, her head is forward, her back is hunched backwards.
Yeah.
So what we're asking is, as Karen drives home, and we know that Karen has a couple different stoplights to hit, right? So what I want her to do is make sure that her shoulders are relaxed, breathe, and she's going to push her shoulders and her neck or her head in a neutral position back into that headrest. And what we want to do is hold that while it's red. As soon as it turns green, she can relax back to her normal, put the hands back up on the steering wheel, because you don't drive without those. So, well, sometimes she does.
Oh gosh.
So we're going to go back into that and then relax and go back into the position where you're going to roll and put those shoulders back into the headrest. Relax those shoulders just a little bit more. Relax, breathe. Push the head back.
Okay.
And as soon as it turns green.
So it's like
so
a
a
neutral net.
stoplight's, anywhere, 15, 20 seconds maybe, depends how long you're there. So we're really talking, 15, 20 seconds. But if you do that every time that you stop at that, it's a constant reminder, and it's a constant pattern that you're developing to bring those shoulders back. And so go back to your side a second. What we're really looking at, and bring the shoulders back and that head back for me. So you see where the middle of Karen's ear should be aligned into the middle of her shoulder. The middle of her shoulder is going to be aligned to the middle of her hip, and the middle of her hip is going to align right into the middle part of her ankle, the middle lateral malleolus there. So if we drew a line from the ear to her ankle, we want that line straight, because what we want to do is make sure that the curvatures in her neck and the curvatures in her back are equal, or somewhere between 38, 42 degrees, not over that and not under that. And that's really what we're doing. We're working on the different curvatures of the spine. And by working on that posture, you're creating that less stress. So again, going back to what we talked about with the weight of our head, just the weight of our head pulled back between our shoulders is going to make that weight a lot less heavy, and a lot less stress on the neck muscles and the shoulder muscles, and it's going to not affect down the middle of the back, lower back, and so on.
And so on. And I could even feel, and Karen, do you feel your abdominals and like even your back muscles like engaging now with the straight posture? Yeah. And another thing too, if you just go back to like the hunched over position, this is something too, like if you were to see somebody with a hunched over position, you would maybe even think, that they're not that confident. They, so even having a straight posture, look at that confidence. It's like you're back in it. You feel great about yourself, So not only is it a health thing, but it could also be a confidence thing.
Exactly. And going to what you do, Veronica, you have people coming in, they want to beautify themselves, right? They want to look beautiful. They want to look good. So if you're going to want to look good on the outside, you should want to feel good on the inside. And posture is a confidence builder. It's making it up. I don't know how many times, I start talking about posture to my patients, and they're sitting down in front of me, and all of a sudden they sit up, right? I'm like, all right, well, I saw you coming in. So, but we know we need to work on that. But again, beauty is outside and inside.
All right, Karen. Well, thank you so much for showing us that. And I hope that this helps everybody in the audience kind of see what it should look like. And then once you get used to it, it's kind of creating that muscle memory, right?
Correct.
Of saying, okay, now I feel this way. I feel that, my back is hurting, whatever, but I know that this posture should feel this way. And now I feel more relaxed. I can, adjust to that.
Yeah. It's opening up your breathing. It's opening up your chest, so you're not putting as much tension, and you're creating a better, healthier you.
Yeah, I love. Okay, that is so helpful, and also for girlies like me that can't make it to the gym every day, it's nice to know that I could use this as a little clutch and say, actually, I drove all day today, but I worked out all day. Also.
Exactly. So you can always say, I worked out.
I worked out. I definitely worked out.
I deserve a break.
And when we're talking about, chiropractic adjustments and things like that, we often think about pain. And a lot of this pain is really coming from like nerves and, all of that. So how are chiropractic adjustments helping our nervous system?
Right. So the spinal cord is housed inside the spinal column here, all these bones that are basically protecting it. All right. So we have the brain, we have the spinal column, and then we have the spinal cord inside. And then along the spinal cord, you have these little holes on the side, all right? And what happens out of these IVFs is basically you have these nerves that come out, and these nerves all follow a certain pattern. So up in the neck, they may go to your arms, eyes, ears, nose, mouth, those type of things. In the middle part of the back, they might go to your lungs, they might go to parts of your intestine. In the lower back, they're going to go to reproductive organs, they're going to go down your legs, those type of things. So how the nervous system is affected is that when an adjustment is made, you're basically restoring motion, but you're also stretching and stimulating those nerves and where those happen to come out at. And so by doing so, you are sending a signal, synapses, basically brain, all the way down to where that output goes. So let's just say up around this area of C4, C5, it's going to go down to your arms, down to the first couple fingers in your hands. So by doing that, we're going to send those signals a little bit better. So by having those adjustments, it's going to make things your body basically function at a little bit faster rate. So I use a lot of times, right?
Yeah.
So the analogy, when I've talked to you in the past about using the internet, right? So, being a Gen Xer, I grew up on 56K, the slow internet, but we waited that long. So nowadays, everything is digital, everything is fast. We would much rather work at a faster pace where those nerves are kind of coming out than at the 56K. So not to say you can't function at that, and you can, but you're going to break down. Your body's going to break down a lot faster with that. So it's kind of one of the ways that the nervous system works. It's basically making that pathway from the brain out to wherever those nerves, organs, body tissues, bones are going to, what they innervate.
So it just makes it a more seamless approach. It's more direct rather than
Correct.
It being like a nerve being pinched or something,
Right.
or a bone being out of place, and then all of a sudden you're feeling like you said earlier, it's like dial up. You can go get the milk, come back, and then the page will finally load up.
Right.
It's in the same kind of sense that
Right.
you're saying if we open those pathways up again, then you can have a more of a streamlined approach to your activities.
I mean, we all get sluggish, right? We all have sluggish days. Chiropractic, in terms of the adjustment and stimulating the nervous system, that's going to open that up so that, maybe you're not as sluggish. I'm not saying it's not going to happen. There's other external factors that cause that. But definitely this is one path and one way in terms of helping your body make it a little bit more energetic.
Okay, awesome. Well, thank you. Thank you for
Yeah.
the visual also.
Yeah.
And so when we're talking about the nervous system and all of that, I think that it's very complex, right? So I think something that we can say is come in and have a consultation. We can talk about what is happening and then ways to address it.
Right.
So I know a lot of people think that chiropractic practices is scary, right? Because we're used to these mixed martial art, movies from like the 80s and early 90s where they can snap your head and kill you.
Right.
So can you debunk or tell us if that is actually real? Can you kill us by adjusting our neck?
Well, I have used that as an example to my children. And I'm trying to get them to do something, but no, I can't kill you by adjusting you. And I understand. I mean, there's a lot of hesitation to do chiropractic because there's a lot of misinformation out there in terms of its safety, efficacy, and all those type of things.
Yeah.
And really, there isn't a lot, anything can happen, right? I mean, so can something bad happen during a chiropractic adjustment? Absolutely, it can happen.
Yeah.
You can also have something bad happen during a medical procedure or a surgery. And a lot of the stuff out there is showing that chiropractic care is a lot more safer and a good route to go. So no, in terms of what you see on TV and those type of things, no. And I get a lot of hesitation, and I have to put a lot of fires out when people come in, and we try to do our best to demyth or debunk some of those myths on that. But no, I mean, 2023 stats show that there was a higher incident of 22 or 23%, something of that nature, of high incident injury happening at a hospital, or fatalities happening in a hospital than a chiropractic office. So and one of the other things too is that our malpractice insurance is a lot lower than some of the other medical or healthcare providers out there, and there's a reason why that is.
Yeah,
because there's less incident of really doing
the risk factor is much lower.
Yeah.
Yeah. So then for another...
We're body mechanics.
What'd you say?
We're body mechanics.
Oh, there you go. Yeah. Well, and it's like, you can take care of your body at home, right? By eating right, going to the gym, doing yoga, all of these things. But just like we use that other analogy, you can brush your teeth every single day, but then you have to go to the hygienist, a couple times a year to get that real nice deep cleaning, in the same way that you would go to a chiropractor to get a good adjustment every now and again to help support all your other activities.
Brows are going to go bad. You got to touch up that stuff, right?
You do. You do. Yeah. So another huge myth that I'm sure you've heard of plenty of times is, if I crack my knuckles, will it give me arthritis?
No, it's very annoying, but no, it's not going to give you. There's nothing out there that really says you're going to have anything bad happen because you cracked your knuckles. If you crack them all the time, you can create hypermobility. Because I have people coming in. This is I've had parents come in, and they come in with their early teenage children that are coming in for chiropractic care, and they're like, can you tell him not to crack his knuckles? And I have to kind of debunk that in front of the parent. I hate to do that sometimes, but, because they're cracking them and all that. What it's doing basically when you crack, those knuckles is basically that you are stretching the capsule in between that joint, and that stretching of that capsule is decreasing, putting decrease of pressure in there. You have what's called synovial fluid, and synovial fluid is basically the WD-40 of in between the joints. All right, it gives it lubrication, and when you stretch that capsule and stretch that joint, it's going to eventually, if you take it further enough, it's going to create what's called a cavitation. And cavitation is that popping sound. Okay. All right. And that popping sound is basically nitrogen and carbon dioxide being released in that joint. All right. It's taking that negative pressure, creating a positive pressure, and creating that popping sound. Much like if I put a suction cup on the window and try to pull it off really fast, it's going to create that pressure and that sound. Put my finger in my mouth, create that popping sound. All those kind of happen, but no, cracking your knuckles, go for it.
Go for it. And everything in moderation.
Right, everything in moderation. And I have, also people coming in and they're like, doing this and doing this in front of me. And I'm like, really? But again, overdoing it and overstimulating and over adjusting that area, manipulating that area, you're going to create hypermobility. You're going to create a weakness in that joint, and that's not really what you want.
And so is the hypermobility really coming from like this overstretching of the ligaments that surround?
Exactly.
It's not
that
necessarily
overstretching that capsule, overstretching those ligaments, and that can happen not only in the knuckles, but it can happen in pretty much everywhere you have a joint if you happen to be doing that a lot. So
okay.
you do a lot in your lower back, and you're not working on core strengthening, then you're going to create hypermobility, and there's a possibility that you reach down, get a piece of paper, and boom, all of a sudden throw your back out. So,
yeah. You hear about that all the time. All the time.
Yeah. You'd be surprised at how many people come in that I never had back pain. I don't know what's going on, but all I did was, reach down to pick a pencil up or, pick a toy up off the floor.
And
they
couldn't
come
get
in
back
for
up.
that, right?
Yeah. Okay.
80% of the population will have some type of low back pain in their life, whether that's weekend warrior stuff, it's an accident, those type of things. But they're going to have some type of incident, and again, maybe they take over the counter, maybe they see a chiropractor, maybe they go to physical therapy, maybe they're surgical candidates. I don't know, but that statistic's out there.
Okay. And there's another myth, right, that I want to kind of go over. And I used to work for a dentist, and he kind of had to face the same, criticism, we could say. But are chiropractors real doctors?
So we're licensed in all 50 states. We follow the same patterns that medical doctors do in terms of taking boards. We have to take boards that are licensed through the state. I'll just use Illinois since we're here. We take boards. I have to pass those boards with a certain grade, all those type of things. The education component of that is you have to have an undergraduate degree to get into chiropractic school now. Beyond that, it can take anywhere between 3.5 to 5 years beyond. So you're looking at, 7.5, 8 years of schooling, really, to kind of go through that. We are licensed through the Department of Professional Regulation. We have to have the same amount of hours, continuing education hours, as medical doctors and DOs. And then where we really kind of differ is our philosophy. We're holistic. We don't use medications to treat our patients. Where the medical faction will pretty much have to go that route. So where we turn is we start learning more about chiropractic technique, philosophy, those type of things, and then the medical will go on to pharmaceutical and have their residency in that arena. So.
Okay, and you guys also go through something that's similar to residency.
Correct. We do an internship
at
the end. It's not as long as a residency, so I understand, where people might be confused by that. But yeah, it says physician underneath my license. So yeah.
Okay, so if I come to you, or if I'm, going about my life thinking, I don't have any pain, I don't have any kind of problems, right, why would I benefit from coming to visit you?
Right. So that's a big question I get from a lot of people, when I'm talking about chiropractic. Well, I don't really have any pain, and that's great. So you're not talking, most people that come to see me, it's about acute care. So, again, going back to bending over and hurting their backs, or looking up or reaching for something and they hurt their neck. So that care is different than somebody that doesn't have any pain. Somebody that doesn't have any pain, you're talking about wellness and holistic care, and you're talking about, again, going back to what we talked about with posture. Can posture alone do that? Well, we still have bananas of life. We're still going to slip and fall, and we still have stress, and we have lack of sleep, and we have our jobs, and we have all these other things that can cause restrictions and can cause our spine to tighten up and the muscles that are attached to that spine. So by treating the body from a chiropractic standpoint and working on the musculoskeletal problems, you're basically addressing those issues and loosening everything up, increasing flexibility, decreasing, the chances of maybe early onset of arthritis setting in, because you've got motion in those joints. We're able to catch things a lot sooner sometimes. I've got patients that come to see me that they tell me when they want to come see me, and that's really kind of the goal, isn't it? To, I know what my body needs,
Yeah.
instead of somebody telling me what my body needs. So
Yeah. And I know that you mentioned earlier when we were just kind of like chatting before we started the show, but you said it's really about like creating that homeostasis within your body, right? And if we are carrying a lot of stress in our shoulders, tension in our necks, if we're having, I know a lot of women complain about, I am stressed and I have these 10 pounds that I can't lose.
Right.
And I know it's because of stress. How is the chiropractic adjustments helping with all of that?
right. So what we talked about earlier on the nervous system and things like that. So although we are treating musculoskeletal conditions most of the time, what happens is by stimulating the nerves in that area, other things can be affected by that. So let's say somebody that might have digestive issues.
Yeah.
You know, in the health history, they may have never given me that information and said that.
Yeah,
that they
because you
have
normally
digestive-
wouldn't link digestion
Right.
with your
Most people
spinal
coming
cord.
in
Yeah.
would be like, well, I'm here because I've got headaches or I've got, low back pain and neck pain. And we start working on their lower back and lo and behold, they're like, I've been coming in for a few visits and I'm not having, the digestive problems or my stomach isn't as upset as it used to be. Again, going back to that nervous system, we're resetting, you use the word homeostasis, and homeostasis is basically in having equality, of our body, equal balance, left and right side equal. And by stimulating that nervous system and making yourself better, you are, in essence, resetting your body. And that's what we want to do. We want to reset our body. We may have better sleep through that because of those nerves are relaxed and the muscles are relaxed and doing all those type of things. There you go, talking with my hands again, aren't I?
I know, it's okay. But I think a lot of people also don't realize, and maybe this is just your practice, so please correct me if I'm wrong, but I know that in your practice, you guys don't only do adjustments, but then you do like that super soothing massage too.
Yeah.
So you get both. Is this something that's very common in chiropractic, or is this just something that you saw benefit?
It's something that I started way back when I first started. I would say the first 6 months of my practice, I did a lot of the work, and we did some stretching and all those type of things. And then I brought on a massage therapist. And by having a massage therapist, we were able to kind of work through some of those tight muscles, some of the muscle spindle fibers that need to kind of be worked a little bit harder in terms of scar tissue and maybe, those patterns that have been developed over time, that we're resetting those patterns through posture, but we're also loosening everything up and making things nice and loose. And by having a more well-balanced practice of having other practitioners and other therapies involved, we're giving people more. What I've noticed is that by having them in practice with me, it has shortened the acute stages of treatment. So somebody coming in with low back neck pain, something of that nature, they are recovering faster than just the adjustment itself.
Yeah.
So, they're both beneficial.
And you just made me think of something. So I'm sure that, maybe before you had the massage therapist, clients or patients were still coming in and super nervous. Right? Super nervous, a little tense, maybe even harder to adjust because you're like, okay, you need to relax. But now with the massage therapy, and then going into get an adjustment, you're already starting at a whole different
level. A lot of people that have come to see me, they're like, oh, I haven't had that before. I've been to chiropractors before, but I haven't had that. And there's so many different things that there's chiropractors that treat so many different ways. And not one way is better than the other, to be honest. If this works for you, great. If it doesn't, there are other chiropractors and other things around, right? We all kind of had that. I don't know how many dentists I went through before I found the one.
The one for you.
Right. Yeah. So, and you kind of have to find what works for you. It's hands-on. What we do is hands-on. What you do is hands-on. So if you get in there and they don't feel comfortable with what you've done or what you're doing, then I'm not going to be hurt if they go on to somewhere else. But I want them to go on to somewhere else, just like you would want somebody to like, look, you
Still
could really
for help.
benefit, right?
Yeah.
You know, really,
Yeah.
you know, so, you know, so that's kind of where we do. I'm not going to, I'm very, you know, you know me, I'm
Yeah.
you know, laid back, take it easy, that kind of stuff. And
Yeah.
but what I ultimately want is what's best for the patient and what's going to take them to the next level of their care, whether that be acute care and we say goodbye, or it's something that they want to stay with me and kind of help with their own bodies.
Absolutely. And then I also just wanted to touch really quickly on a point that you said about habits, right? And we briefly talked about how I have a little nephew who has a grandpa who has scoliosis. So he has a different walking pattern. And we've noticed that he kind of mimics that. So a lot of these patterns are really coming from a child, you know, by maybe it's not something that is actually misaligned within you, but then you see adults doing this, and since you want to be like the adults, you're mimicking this. So a lot of these habits have been with us since we were kids.
Right. Yeah. So, you know, patterns, you know, going back to patterns again, you know, we start developing postural patterns as soon as we start crawling as babies. You know, we crawl and we lift our heads. We're starting to develop the neck muscles and the bones in the neck. As we go from crawling to standing, we now start to develop the neck and the lower back muscles. And we're starting to basically work on those patterns. Then everything in between that, you know, from, you know, as I was saying earlier, you know, car accidents to sports to how we sit, how we stand, all those type of things. Pregnancy, it affects, you know, how our posture will be, because again, the pelvis is going to rock and shift differently and open up for pregnant women, regardless of how that baby's delivered. So you're talking about postural changes there and loosening the muscles. So yeah, posture starts at an early age and we can work on it all the way. I've got 99-year-olds that are still working on their posture. I'm like, get it back.
Okay, let's
work.
get it back. Okay, so I have two more questions for you. You know, we kind of went into this a little bit earlier, where I was telling you that I have a little nephew that has a grandpa who has scoliosis, and he's developed different walking patterns because he gets taken care by him, you know, pretty often. So my question is how young or are you seeing babies in your practice, and what are the benefits of seeing a chiropractor at that young age?
Right. So, I mean, yeah, we've seen babies in our practice all the way from birth all the way to 99-year-olds. So what would be a benefit for infants would be, you know, everybody's heard about colic. So, you know, colic is something that obviously is something that a lot of mothers deal with their babies. So having a chiropractic adjustment on that infant is going to basically work with the nervous system. Again, what we were talking about before, in terms of having that adjustment, stimulating the nerves in the middle part of the back to kind of calm and soothe that baby, so that canal, or I'm sorry, that the synapses basically from the brain all the way to out where those organs go will be calmed down. So,
okay, and then my second question is: are pregnant mamas coming in to get adjustments?
Yeah, we actually had one today, and what it helps with is some of the discomfort, obviously in the lower back, but it also kind of helps ease the birthing process. So you're kind of, again, with the nervous system, you want to make sure that everything is nice and easy. What happens during the birth is that baby is growing, and once that baby gets to a certain age, a lot of time, or certain growth inside the uterus, that baby can push down on the sciatic nerve. So I have a lot of times where moms will come in with either sciatic issues or rib issues, because again, you're growing, you're expanding, and having the adjustment and having some work done, again, you know, will help with that. And again, they love the massage, but the adjustment will help as well. So it's kind of a full body type thing that we work on with them.
Oh my goodness. Yeah. Because I can just imagine, you know, we deal with women, you know, all the time. And I know that they are constantly talking about their organs being taken over by that baby.
Right.
And right now that you mentioned the rib cage, I'm like, can you imagine having your breath restrained because you have this whole new baby that's in there and not letting you expand and contract at a normal rate? So this could be a big benefit to them.
Yeah, it's really hard sometimes because mamas are coming in and they're feeling I can remember one in particular that something's really bad. My rib is hurting, and we worked on it and stuff, but the bottom line is until that baby's out, it's going to continue to grow and it's going to continue. So that's the bad part, because then I'm like, I didn't do this to you, ladies.
It's not my fault.
Right. So it's one of those things that once the baby is out, everything is loose. Everything is, and my job will be to kind of make sure that everything kind of goes back to normal as best as possible. But we tried to do palliative care and make sure that they're comfortable while the baby's growing.
While the baby's there. Yeah. I can't imagine all the different changes in their bodies that they go through to be able to create a little human inside of them.
Yeah.
Thank you so much again for joining us and giving us all of this information. I know that I'm fortunate enough to be able to ask you random questions all the time, but I'm so happy to be able to share all of this information with all of you guys. And thank you for tuning in to Beauty Talk Podcast. We hope that today's conversation with Dr. Frazer gave you a fresh perspective on how chiropractic care can be an essential part of your beauty and your wellness journey. Whether you're looking to improve your posture, reduce stress, or simply feel your best, your spine may be the place to start. So this episode was proudly sponsored by G Skin and Beauty Institute in partnership with estheticians.com, empowering future beauty professionals through education and innovation. Don't forget to subscribe, leave a review, and share this episode with a friend who needs to hear this. Until next time, stay glowing, stay aligned, and stay beautiful. Thank you so much.